Hi, I'm Dr. Rafael Inigo. I'm a certified orthopedic surgeon, specialist in knee surgery. I practice in Hermosillo, Sonora, Mexico, and I have prepared for you a talk explaining total joints, especially total knee. Join us. Osteoarthritis is a progressive wasting of the cartilage, either for trauma, disease like a rheumatoid arthritis, either malalignment, or some unknown causes like genetics. And we make diagnosis by hearing the patient, having the clinical frame like stiffness, joint swelling, loss of motion, no responding to analgesics, X-ray showing narrowing of a cartilage space. We know many factors like obesity, trauma, inflammatory arthritis, and intra-articular steroid injection, hemophilia, and some genetic causes as well. Many treatment options like, for example, exercising, anti-inflammatory, eventually synovectomy, osteotomy, restructuring of the bone axis to shift the stresses from disease to more healthy tissue, and eventually total knee replacement when the waste of the cartilage is total or near total. An estimated 21 million adults have osteoarthritis after the Journal of Arthritis and Rheumatology. An estimated 2.1 million adults are affected by rheumatoid arthritis. We know that obesity is very closely related to problems of osteoarthritis. 17.5% of people of normal weight report doctor-diagnosed arthritis. Weight loss as little as 11 pounds reduces the risk of developing knee osteoarthritis by 50%. So it's very important to keep the weight under normal limits. Very, very important to do exercise to strengthen the muscles. Total knee joint, what is it? Well, it's just a substitute of a wear joint with metal alloy and ultra-high molecular density plastic components to replicate the joint function. Three major components like femoral implant, tibial implant, and patellar implant. It does reproduce the motion of the normal knee joint. Who needs it? Virtually any person of any age that despite the treatment suffers from pain and that the x-rays shows a substantial loss of cartilage. We have common risks associated with total knee replacement. For example, infection, thrombosis, rejection of material, and this increase with obesity and sedentary people, also people with cancer. But we do prevent this potential complication with pneumatic pumps, which resembles and stimulates the circulation, last generation oral anticoagulant, early motion, and some antibiotics too. In this way, we keep away as much as possible any potential complication which is natural to this kind of procedures. What type of anesthesia? It usually spinal block, and it has a lot of advantages. The patient remains awakened, actually interact with the anesthesiologist during the procedure, and the same catheter serves as a way to deliver analgesics, thus avoiding the pain postoperatively. We shape the bone to match the implant. Many times the joint is wear and has a gross deformity like in the picture. We have to match perfectly the implant and the bone. We place some cement with antibiotic and we impact the components. What do we expect in the immediate post-operative period? A relative rest for 24 hours, start walking with the help of a walker, analgesics via intravenous and through the catheter, and an early gait, early walking. After you're discharged from the hospital, we have a 7-day physiotherapy sessions, continuous passive motion as much as you can, and to enjoy the life from your new knee. Where? At Hospital SEMA. We have now CIMA in Hermosillo as International Joint Commission Certified Hospital, as a safe hospital in Mexico. We share the state-of-the-art technology. Because life is worth living, plenty and pain, it is not an option.